Hip replacement, it's replacing pathologic part of the bone, disease bone of the hip joint with artificial components such as metal and plastic or plastic and ceramic components, and taking the pathological part, relieving patient from pain. Who usually needs hip replacement? Hip replacement required for patients who suffer from end-stage arthritis of the hip or end-stage avascular necrosis of the hip. This is all medical term, but to make it in a lame language so our patient will understand that if patient has a severe pain and decreased mobility of the leg or the hip, if patient wake up in the morning and cannot look forward to spend the day because he knows that he's going to suffer through a whole day with this pain and it's not going to give him a joy of life, or patient who wants to go to sleep and really not looking forward even for that because he knows he's going to be awaking at night because of the pain. So that pain can be alleviated with a hip replacement. I will explain in a lame term how does it happen and why so much pain happen in a patient who suffer from the certain disease like osteoarthritis or inflammatory arthritis or avascular necrosis. Our joint designed to be perfect, designed so we can have a full mobility, we can walk, we can jump and never have pain. Why can it happen? Because we have a layer of cartilage. Cartilage is a cushion around our joint that protects our joint from injury, from pain, make our joint slide smoothly. Cartilage has pretty much no pain receptors. So that's why when we jump, when we run, when we do all this stuff, we give all this absorption to the cartilage and we don't feel pain. But with the time or with a certain pathology, cartilage wear off. It's like when you're driving a car for a long time, the tires wear off. Same with the cartilage. And once cartilage is not covering our bone anymore and bone getting exposed, bone has a lot of pain receptors. Then we start feeling pain. And this pain giving signal to our brain and our brain saying, hey, it hurts, you're injuring me, don't walk. That's why more and more people who suffer from end-stage osteoarthritis and who have no more cartilage left there, sometimes the joint can give up, they can buckle and fall on the floor and injure themselves even more. That's why it's important to address this problem earlier and either surgical or non-surgical and treat it so nobody suffers from that type of problems. There is a different type of hip replacement considering the implants as well. There is a metal on metal, there is a plastic on metal, there is a plastic on ceramic. The different type, it's considering with the implants. There is also a type of hip replacement that's called hip resurfacing, but because metal on metal materials falling out of the favor now because of metal ions, the most common hip replacement now is a metal on plastic. The other part difference in a hip replacement, it's approach, how to approach hip replacement. There is three most common approaches exist now in United States, how to approach the hip replacement. It's from the back, which is called posterior hip replacement. It's also from the front, that's called an anterior hip replacement. And there is a more revolutionary approach. There's a newest approach to hip replacement that's called superior capsular and percutaneously assisted hip replacement. That's the hip replacement I perform. I actually first surgeon in Long Island who performed that procedure, and I'm one of the few surgeons in New York who perform suprapad hip replacement. I will explain what's the difference between suprapad hip replacement and between posterior and anterior approach for a hip replacement. With both posterior and anterior hip replacement, when you approach the joint, you have to violate the capsula. It's either posterior capsula or anterior capsula. The capsula, it's a structure that holds our hip together. This is our hip joint, and there is, or I will show you this type of implant. That's the hip joint after hip replacement and the capsula that go around the hip joint. So there is a posterior approach when they cut in the back. There is an anterior approach when they cut in the front. The suprapad hip replacement We don't touch the capsula in front or in the back, as well as we don't touch any muscles that's in front or in the back. We're going from the superior portion of the capsula. We made a small incision over the capsula, and all hip replacement done in situ. What's mean in situ? That the legs stay in one position through whole surgery. With both anterior and posterior hip replacement, the hip have to be dislocated. With the dislocation, we have to bring the hip and put it in awkward position, which is not normal anatomical position for a patient, which can create a kicking to the artery and vessels and nerves. With the suprapad hip replacement, the legs stay in one position through whole surgery. Why it's better? I think it's better because the patient does not have to go through any precautions after surgery. He can sit in a lower chair, or he doesn't have to wear anything between his legs right after surgery. And I think recovery process is much faster than either with anterior or posterior hip replacement. What's the benefits of suprapad hip replacement or superior capsule percutaneously assisted hip replacement? With posterior and anterior approach of the hip replacement, after surgery, at least for the first 3 months, patient need precautions. Precaution, that's mean with anterior hip replacement, there is a risk of anterior dislocation of the hip. He cannot stay straight or exaggerate external rotation or bring the leg out. With a posterior hip replacement, he cannot sit in the lower chairs. He have to always have something between his legs when he sleep for the first 3 months to prevent from posterior hip dislocation. With a suprapad, you don't need that. You don't need any precautions because you did not violate posterior or anterior capsula, back or front of the hip. The capsule is intact. The muscle is intact. The hip through the surgery did not go to any awkward position. It wasn't dislocated. So it's also a big benefit. So the hips stay in situ, and patient's recovery time is also much faster. It's still a recovery time. It's still a surgery. You cannot say patients, so even the suprapad, you will be run day after surgery. No, you still need a recovery time, but recovery time is much faster than if you use anterior or posterior hip percussion.